Rebecca Nansubuga walked into this pharmacy in Nansana in Wakiso without any prescription to buy anti-malaria drugs for her son, who she suspected had malaria. The pharmacy attendant inquired about the sickness history of the baby before she could sell them any drugs. She recommended a quick malaria test, which was conducted at the pharmacy. Although Nansubuga did not know about the malaria rapid diagnostic test until she walked in here, she was open to the idea. In just 15 minutes, the results were out.
If the patient is positive, I have to give the first line treatment because there is some treatment we are supposed to give over the counter for the treatment of malaria. So I give that one. If I see, because we classify malaria in some classification according to what the signs, when you ask the patient what you see. If the patient is not so critical and I can use the first line treatment for malaria, I use that one. But if it's critical, I have to refer for further management.
The health workers there are trained, very well equipped with all the information, how to test you, how to treat you. They have undergone what we call the integrated disease management training thoroughly well, and we assess them routinely.
As part of the practice, the World Health Organization and the Ministry of Health recommend that before one can use anti-malaria drugs, they must conduct a blood test. But quite a number of Ugandans like Nansubuga resort to buying anti-malaria drugs over the counter without confirming whether they have malaria.
Once they feel loss of appetite, the headache, a dizziness, drowsiness, some kind of, they just go straight, give me anti-malarials, I'm sick. Yet in actual sense, they actually don't have the malaria. So we are moving away from the guessing that I guess I have malaria. And then we are saying, no, let us not guess. You get tested, confirm, and if you have, then get the right treatment.
5 years ago, the Ministry of Health introduced the malaria rapid diagnostic test.
A device that we can use at a very short time to test, to know whether somebody has malaria parasites.
It was first introduced in public health facilities and later at the grassroots.
Some never had functional laboratories. Yet malaria, as you know, in the past has been predominantly counting almost 40% of the OPD cases that we register at our outpatient clinics in the public facilities.
Last year, the Ministry of Health and its partners like the Malaria Consortium extended the rapid malaria testers to private facilities, especially pharmacies and drug shops.
The essence is to target all patients at all points where we are dispensing medicines.
Today, anyone can walk into a drug shop or a pharmacy with the MRDT sign and get tested before they can take any medicines at a cost of 2,500 shillings.
Not like previously, you go to a clinic, they ask you for consultation fee, then this and that, and then, but now the process is simple. We are making it simpler for somebody to access the right treatment for malaria.
This malaria testing kit, according to World Health Organization, has a panel detection score of 98.7%, a false negative rate of 1%, and a total false positive rate of 2.4%. This initiative could go a long way in fighting the scourge.
Our results have shown an increased uptake of the service from about 27% to the current 83% when we began from August last year, 2014, to August 2015.
The 2014-2015 Malaria Indicator Survey shows that prevalence of malaria has dropped from 42% in 2009 to 19%. Despite the remarkable stride, malaria remains the #1 killer disease in the country. The drop in the prevalence levels has been attributed to several interventions such as scaling up treatment, spraying and use of insecticide-treated nets, among others. Gertrude Tumusime, Uitkware, NTV.